IVF, as we have discussed also, the success rate is not 100%. So when the IVF fails, the next question comes, madam, what next? What next depends upon many factors, like the age of the patient, how her response was during the ovarian stimulation, how many follicles were formed, how many eggs we got, what was the quality of egg, what was the quality of the sperm, then how many embryos we had, and what was the embryo quality. So if everything is favorable, then we definitely advise the patient to go again with their own gametes, and definitely they should try further. But at any point of time, if the age is the factor, or if the number of eggs are not good, they are very limited in number, the quality is also compromised. If we don't have good quality embryos, or the endometrium is the factor, endometrium is not developing with all sorts of the medicines, and if we have tried everything, then we look for the other options. Before that, if everything is okay, as I told, we keep on adding the advanced procedures like for the blastocyst transfer, for the pre-genetic testing, because sometimes even though the embryos under the microscope looks healthy, they looks grade A embryos, and in spite of that the implantation does not take place. So there we advise them to go for the embryo biopsy to test them genetically, whether they are genetically normal or they are genetically abnormal embryos. Because by PGT we come to know if this out of 4 to 5 blastocysts, if 2 or 3 blastocysts are abnormal, then those abnormal blastocysts will not be transferred. Then only the normal blastocysts are transferred to give them the pregnancy. And suppose if we get the report saying that none of the embryo or the blastocyst is healthy, then we need to counsel the patient accordingly. Then the best option for them to go for the donor egg IVF. Similarly with the sperm, if the sperm is not good, then the sperm morphology is studied in detail, then we advise them to go for the DNA fragmentation test. There is a genetical testing, and accordingly the decision is taken whether we should take again the husband sample for the fertilization or to ask them to go for the donor sperm. If we find any problem with the uterus, the lining is not good, or in spite of the good endometrium, if the implantation is not happening, then they are asked to undergo the implantation or the receptivity check. So there is a test that is endometrial receptivity assay, where the biopsy of the endometrium is done and it is sent for the examination. So the report tells us that this is the window period, this is the time when we do the embryo transfer, the chances are better. So that is known as the personalized embryo transfer, because that window, it differs for every individual, every patient. So based on that window, then the embryo transfer for that particular patient is decided. Now if there is a report saying that the receptivity window is very limited, or the receptors are not there, or the endometrium is not good enough, if it is not going beyond 5 millimeter and the patient does not want to take any chance, then best for them is to go for the surrogacy treatment.